A pneumothorax is known as a collapsed lung, which occurs when air leaks into the space between your lung and chest wall. Lung collapse can be caused by a chest injury, which can be resulted from any blunt or penetrating injury to the chest. It could also be caused by underlying lung diseases like COPD, cystic fibrosis, lung cancer, or pneumonia, in which damaged lung tissue is more likely to collapse. Small air blisters or blebs that form on top of the lungs can also lead to pneumothorax, in which the air blisters burst, allowing air to leak into the spaces around the lungs. So let's get started on the disease process. In pneumothorax, the atmospheric air enters and accumulates in the pleural space. The presence of pressure in the lungs causes the loss of negative pressure. The intrapleural pressure is normally negative because of inward lung and outward chest wall recoil. The loss of negative pressure will lead to increased intrapleural pressure. When there is increased intrapleural pressure, it will start pushing towards the intrapulmonary pressure that will compress the lungs and start collapsing the lungs. When your lung starts to collapse, it will be difficult for your lungs to get oxygen into the alveoli. So there will be less oxygen that will diffuse from the alveoli into the lungs. A decrease in oxygen diffusion will affect the supply of oxygen into the pulmonary blood and then into the systemic arterial blood, so this will lead to hypoxemia. As a result, the patient may experience dyspnea. Hypoxemia will as well increase respiratory rate or the person become tachypneic and increase the heart rate or tachycardia. The compression in the lungs will also cause a mediastinal shift from the affected side to the unaffected side, so in an X-ray, there can be an indication of tracheal deviation. Also, when there is increased intrapleural pressure, it will decrease lung compliance or the ability of the lungs to stretch or expand. This will increase an individual working of breathing because the person must work harder to inflate that lung against the high pressure within the pleural cavity. When a person's work of breathing is increased, you'll notice that he or she uses accessory muscle. Another thing is that when you increased your breathing, there is a separation in the pleural lining. In that lining, there is an actual nerve ending that supplies pleural lining. So when there is a separation, the person may experience pleuritic chest pain or sharp pain in the chest.